Yes, greetings to you. Hopefully you're doing well. I want to welcome you to HBMS TV Talking Health, where we particularly talk about different things to promote good health. So for our focus today about our first aid series, this is series part 5. We are going to be talking about cardiac arrest. But before we get into the details, I want to send a vote of thanks to our sponsors, that is Mityana Institute of Nursing and Midwifery. Thank you very much for sponsoring these programs. And if you're out there and you're a parent and you have a child who you want to join nursing, this is a very, very powerful institution that I can recommend to anyone to take his child. Then I also want to send greetings to Masaka Home-Based Medical Services International. Thank you very much for the great work you're doing in Masaka. But most importantly, I also want to send a vote of thanks to Nasuna Community Nursing Home in Mityana that endeavors to make sure that you can have good health while you're at home. So to all our sponsors, thank you very much for sponsoring these programs. So in our first aid series, part 5, we are going to be talking about cardiac arrest. Remember, the information that we give here is very, very vital for each and everyone who is out there, whether you're a parent, whether you're a student, whether you are a community person, anyone who is there, you need this information. And don't always forget to subscribe to our channel, that is HBMS TV Talking Health. So when we talk about cardiac arrest, it is the sudden stoppage of the heart. At times, cardiac arrest is also known as sudden cardiac arrest. That is, actually it happens is when the heart stops beating suddenly. That is the sudden cardiac arrest, and it results into an inadequate cerebral saturation. Cerebral is to do with the brain, to do with the head and all that, which leads to coma within 1 minute, but recovery would be complete if oxygen deficiency is relieved within 3 to 3 minutes. Somebody can totally recover. But more importantly, if oxygen deficiency exceeds more than 3 minutes, severe and permanent brain damage can occur. So that is to do with cardiac arrest. And more importantly, I also want to discuss something about the causes of cardiac arrest. We have what we call the heart attacks. Mind you, an heart attack is different from the cardiac arrest. Then the other cause is obstruction in cardiac saturation, blood cannot move comfortably. Then injury to the heart, you can talk about electrolyte imbalance, then lack of oxygen to the heart. Then you can even talk about severe drug reaction. You can talk about electric shock due to anesthetic drugs. Then the other one is severe bleeding. Then for students who are out there and you're following us, you just need to know that for purposes of learning or purposes of passing your papers, you can cram the H's and then the T's. All these cause cardiac arrest. You will go through them: the hypovolemia, then hypoxia, hydrogen low ions, then hyperkalemia or hypokalemia, hypothermia, hypoglycemia. Those are the H's. Then the T's, we have toxins, troponin, then tension, thrombosis, thromboembolism, all those things, even including trauma. All those can cause what we call cardiac arrest. Now, let's briefly talk about the signs and symptoms of cardiac arrest. The most important things that you're going to see, we have shortness of breath. At times there is chest pain. Then heart palpitations. You can talk about extreme dizziness. You can even talk about loss of consciousness. But on the other hand, you can even talk about absence of pulse in the major arteries. That is for the medics. Then the other one is unconsciousness. I've talked about it. Then skin color turns blue. That is to the whites. I don't know here in Africa, or if because somehow somewhere our skin may not be seen that it has turned blue. It can turn to dark purple. It can turn to black. You get the point depending on your color tone. Then respiration stops. I earlier talked about that. Then pupils widely dilate. Then you can talk about no bleeding during an operation. When somebody's on table and you find there is no bleeding, just know there is cardiac arrest. Then there is that dead-like look. Then a state of unease, all these things. And what is the first aid management? Very, very quickly. Anyone who is following us at HBMS TV, don't forget to click down there subscribe, click the bell for all notifications, such that you can always get notification for everything that we put up on our channel. So when we talk about the first aid, first confirm the diagnosis. Don't misdiagnose because you're going to do poor management. And the moment you confirm it is cardiac arrest, call for help. Then the other one, you immediately start cardiopulmonary resuscitation, the CPR, right? You need to follow the ABC of respiration. A for airway clearance, then B is for breathing, then A is you assist in breathing by artificial means, then C is for saturation, maintain saturation by chest compression. In future, we will be discussing these procedures on how you can do them. And then the other one, place the person in spine position, or actually on a hard board. Then the other one, clear the airway of any matters like vomiters. You can talk about secretion. You can talk about any dangers. It is part of management, or it is part of first aid management. Then you must hyperextend the neck by tilting it backwards as far as possible. And then you start mouth to mouth. I always call this a kiss of life, artificial respiration with chest compression. Clear the throat by holding the jaw at both mandible joints and give a strong blow in the mouth. You can use a resuscitation tube at times. If it's your fiance, if it's your wife, you can do mouth to mouth and then give a blow to open the throat. Then you need to continue chest compression and mouth to mouth respiration at the rate of 5 to 1. The blows and then the compressions. Then you need to periodically check the pulse in the neck for carotid pulse, check the pupils, and the return of pupillary reaction indicates successful efforts. Continue basic life support and transport the patient to the hospital. I can't forget to send a vote of thanks to our sponsors, that is Mityana Institute of Nursing and Midwifery. Thank you very much for making sure that these programs go on. Then I also want to send a vote of thanks to Masaka Home-Based Medical Services International, a body that has covered very many people in Greater Masaka. And more importantly, I also want to send greetings to Nasuna Community Nursing Home in Mityana that makes sure that people can access medical services while they're at home so that they can live a healthier life. May God bless you. Stay blessed. HBMS TV, talking health.